which is what we charge, $50 per session. It's not covered by Medicare. So they're out of pocket. So you can imagine they're coming 3 times a week. That's $150 a week. That's $300 a month, whereas you could purchase the home-based phototherapy machine for just a little over that, and you can do the treatments in your own home, in the comfort of your own home, the privacy of your own home. And you can pick the days you choose to do. You can do Monday, Wednesday, Friday. You can do 2 treatments running as long as there's a 24-hour gap in between. So you can choose the dates and the times that you choose to do your treatment.
And the great thing is about it as well is it's very portable, it's light, and yeah, so if the patients are going on holidays or something, they can just bring it with them. So it's just really easy.
And we can give them a letter, a travel letter that they can take with them to say that they are doing home-based phototherapy, so they can take the letter with them so they can get through customs, so customs can see it. We advise that they take it in their carry-on luggage just so that it can actually be seen, because we don't want it in their normal luggage that goes in the cargo hold because other baggage gets put on that. It comes in a protected case, but you just don't know. But we give them a letter to state this is what they're travelling with and why they're travelling with it. Now, as I said, it's a handheld device, and as you can see on the picture, it comes in a case. We have our comb, we have our template that we use. It comes with a timer, it comes with protective goggles, and it comes with the instruction booklet as well. Now, it's designed, same as booth-based, to deliver 308 nanometres to target small areas of vitiligo, either on the face or the body. And as we said, the treatments can be done at home, and especially for patients that have time constraints, have got compliance attending the sessions 3 times a week, but also just compliance in general, just not coming into, missing, 2 or 3 days every week because they just can't come in. Patients can work around their own session times, their lifestyle commitments and the privacy of their own home. And for some people, it's a more culturally sensitive option for some to do it in their own home rather than actually coming into having booth-based therapy where they've got to go in, get changed. And they're worried about somebody walking in on them when we say they can close the door but don't lock the door, because if we need to get in for an emergency, we're not being able to get in if we can. So they can do that in the privacy of their own home, it's good for them. They actually opt for that option. It's cost effective. It's safe, it's efficient, it's a one-off purchase. And as we said, it offers convenience and portability. They can take it with them wherever they go, travelling overseas, interstate, staying at a friend's place overnight. They can take it with them. Now, the device comes with, as I said, an instruction booklet, dosage calculations, which we go through and work out for the patient. We can tell them where to buy it. We tell them where to buy the replacement lamps, which is usually you get about 400 hours out of the lamps, which is approximately 18 months to 2 years. And of course that comes with a warranty. So you can see up there we've got the battery, the lamp that they buy. And now with the handheld comb, what it is, comes with a flat comb and it comes with a comb that's probably about 1 centimetre long. Now that can also be used for scalp psoriasis and has been used with scalp psoriasis. We chose to use that to actually be a template on the skin. So the patients can sit the machine on their skin. It's about that far away from their skin when they first do their treatments. And what we usually tell them is we tell them when they get their first doses for the first week to go low, go slow, till they get used to positioning the machine, getting used to using the machine, and they feel comfortable using it. So they're not putting themselves at a risk of a burn or anything like that because the dose is low, and it's a go low, go slow policy. And most of the patients find that that's much easier for them to follow and much easier for them to do. And then, of course, we follow up with them in about 2 weeks' time, and then we follow up in 4 weeks to see how they're going with that. We also get them to take photos on their mobile phone. Because they're continually looking at themselves, they're not going to notice changes in their skin condition. They'll look at themselves and go, yeah, I don't see any different. But when you're looking back on photos, and when they come into review with us, we can say, you've done very well with your repigmentation. Some of those spots that were depigmented are now starting to repigment. They don't notice it themselves all the time because, as I said, they see themselves all the time. So it's good when they send photos and we can actually say to them, yes, you are repigmenting, you've done very well. And it's kudos to them for their commitment to actually doing home-based phototherapy, because it's the consistency that's going to get the results. And they're more compliant doing that. And the research is saying that the more compliant they are, the more successful the results will be. Now, this is just another close-up of the slide, and as you can see, that's the comb, and it's got the 2 lamps in the middle, and this is what you get in the box for $300. Now, in this, it comes in a cardboard box. Ours actually comes in a plastic solid box with foam around it, so that because of the portability, and it's protected. It also comes with safety goggles, so they're UV-protected safety goggles, so that gives them a bit more protection as they need it. Now I've got a case study for you. We had a 15-year-old male. He commenced in 2020 and his repigmentation occurred in 2023. During that time, he had a few life crises. COVID hit. He's now sitting for his HSC. So you can see that he had the vitiligo around in the inner canthus area and around the side of his face. Now, he was once he actually got used to the machine, his stress has settled down. He's now going into sitting for year 12 at the moment. You can see on the Woods lamp, he still has areas of vitiligo, but these two photos show that he's almost completely repigmented. And that's just from his consistence and his persistence in doing home-based phototherapy. Now, it's taken him 2 years, 2.5 years to get there, but he found it much easier than having to come in to have face treatment all the time. He could do it at home, he could do it in between his studies, he could do it in between his sport. Now, we are just so pleased with him, and he's very, very pleased with his outcome. He's still got the tiny little bit in that inner canthus area, so we just went through in being able to reiterate the dose for him, restart, because he had actually stopped. Now, the recurrence rate when you do stop home-based phototherapy, you will start to get small areas of depigmentation, but it won't completely depigment. So when they come back to us, when they haven't been using it for a while and we restart their doses, you will find that they'll start to repigment quite quickly again once they've restarted their dose. Another repigment success story. Now, this is the 29-year-old male. This is the gentleman that I mentioned earlier that started off with eczema therapy. And you can see he started to repigment when he started to have a bit of eczema therapy. But then he switched because he couldn't keep coming to eczema. It was too expensive, time constraints, he couldn't get there, he couldn't get time off work. We can also give patients, if they come to eczema therapy, home-based phototherapy, we can give them, and booth-based, to say a letter if they can't come to eczema therapy, this is what you're doing and why, and you need to be able to come 3 times a week. A lot of employers try to be cooperative in doing that, but some of them aren't. So that's why a lot of our patients have chosen to switch to home-based phototherapy. Now, you can see in 2021, he's almost repigmented on his chin and on his neck where he had great areas. Now, he is so pleased with that repigmentation. Now, this gentleman is also a gentleman who was actually stopped home-based therapy due to COVID. He got COVID, he was unwell to do this. He has come back to us and he does have some areas of depigmentation. So we spoke to him last week, we've recalculated his doses and he's now starting back on home-based phototherapy for the repigmentation. Now, he's still happy with the results he's got, but he has depigmented slightly more than these photos show now. And that's the beauty of home-based phototherapy, is they can come back, we can do the education program with them, we can go through again, we can reset their doses. They have that contact with us. We're available the days that I'm there, the days that Jen is there, we're available. They can send us emails, they can call us. It's not quite 24/7, but we're there to give them advice and support wherever and whenever they need it. They only have to ring, send us email photos, we'll get back to them, we'll suggest what they can do. They can come in and have a consult with us if there's anything they want to ask. We can take more photos. If they feel better off having face-to-face, they can come in and have face-to-face with us. We don't have an issue with that at all. We actually encourage, if they want face-to-face, they can. Does anybody want to ask any questions? No? At the moment? Now, in 2022, we conducted a retrospective review of our patients. Now, I haven't got the latest and greatest slides with the colour photos because one of our doctors, he's also doing presenting on home-based phototherapy. Chelsea's got them today. Unfortunately, I had finished this before I could actually upload the photos. But if anybody wants any information, anything at all, you only need to, my email will be up on the slide. You only need to contact me and I can send you through all the information that we have. Now, with this retrospective study, there's 150 patients on our list. About 5 to 10% of those didn't proceed with home-based phototherapy, or the vitiligo became unstable and they had to go back to booth-based and handheld phototherapy. But the aim of this study was to assess the efficacy, if I push my false teeth in, I might be able to present the word, efficacy of home-based phototherapy, and to assess if the treatment was associated with improvement in the DQIL and also repigmentation. Now, one of the things that we get the patients to do, they do a DQIL when they come to see the doctors, but we do what's called a VidiQual, and there is probably another, I think the DQIL's got 10 questions with probably another 15 questions on the VidiQual. That's Vitiligo Quality of Life Index, which we are now sending out to our patients to get them to redo. We're going to redo our retrospective study using the VidiQual as well to see if there's any improvement in their quality of life with that. That's another project that we're in the process of doing. Now, out of the 131 patients that we had on a list when this study was done, I have to let you know, included in our study there was 61 patients. But out of those excluded, we had 40 who did less than 20 sessions and that didn't come back. They just didn't come back for follow-up. They didn't want to come back. We rang them, no contact. They just didn't come back. So they fell off the study. Also, 10 people, as they had follow-up elsewhere with other dermatologists. So we couldn't really use their data because they weren't coming back to us. They were following up with other dermatologists, so that skewed our research in being able to do that one as well. And 20 people, and the reason that being is they hadn't even purchased the machine and didn't even want to come in once they had seen Dr. Gupta. They hadn't purchased the machine, they didn't make booking, even just for an education session to know how the machine works. Now, when we do our education session, they've seen the doctor, they come to see us, we give them a brief introduction about what home-based therapy is, they get an information sheet, and again, I can send you out all of this information, email it to you so that you can read through it all. And then what we do is we book them in for half an hour to a 40-minute session. When they come in and they sit down with us, we go through, once they've purchased their machine, how to use the machine, how to set the machine up. We tell them to let the machine warm up for 30 seconds to a minute before they use it. Now, when you use this machine, it is seconds versus dose. So the machine you will get, say if you've got someone who's skin type A to B or skin type 1 to 2, they'll start on 0.43 seconds and they'll get 0.3 of a joule. The machine is dose-driven, is time-driven over dose instead of dose-driven over time, which is booth-based therapy. So everyone says, oh, but how does it work? 0.43 of a second equals 0.3 of a joule. So that's how we work it out. It's time versus dose. And we go through all that with them. We give them an information sheet. We give them a treatment sheet to write down what doses they started on. Now, with this therapy, the aim is to get them to be carnation pink. We want their skin to be pink. We want them to have that erythema. That's the important part. We want them to get that erythema. A lot of them think that that is a burn, but it's actually not. We want them to get that erythema. We want them to have that erythema because we know that then the melanocytes are starting to work. Something is starting to happen in the skin. The melanocytes are starting to repigment, and that's what we want to have happen. Now, one of the other things that we also noticed, the mean average of the patient in our studies was 28 years of age. And the mean onset of vitiligo for the patient was 20.96 years. And out of our study, 51% were male and 49% were female. So we had a fairly gender-based equality in doing our study. Now, during the study, 81.7% of our patients got repigmentation through this home-based phototherapy. It works, it's effective. If the patients are consistent with the treatment, it works. Now, 5% of our patients got a suboptimal result. They got disease progression, which the vitiligo had become unstable. For reasons unknown, we don't know why, a section of the population, why their vitiligo became unstable. We have just, whether it's due to the COVID vaccines or they had extra stress, we don't know the reasons why they actually had the disease progression. And 13.3% of our patients literally had no change or very minimal change. And out of those, we asked, how were you doing your treatment? What were you doing? How long were you doing your treatment for? We wanted to review, was it a technique? Was the reason why they weren't having the issues? Was it they just weren't compliant in doing the treatment at home? They got the machine and went, oh, I've got it. Oh, well, I'll do it when and where I feel like it. I've paid for it. I'll do it when and where I feel like it. We don't know what these variables were. And they've just literally said to us, well, I got a suboptimal result. I didn't really get a lot of repigmentation. And some of those we've come back, we've reviewed. And some of them have just said, no, I'm quite happy doing what I'm doing. I don't want to come back. I'm quite happy with the levels of repigmentation I've got. So there's not much you can do with that, unfortunately.
And there's also a few patients that don't want to actually come for the education session. They think that once they purchase the machine, that's it. They can just do it on their own. But as Glenda was saying, like it's a time-based and dose-based. So they need to understand the dosages as well, and also to the treatment schedule, and if they have like a erythema or anything like that, then what they have to do for the next treatment. That's all really important, because otherwise, the patients are going to burn, and obviously that's going to affect their quality of life and, their vitiligo in a negative way as well. And yeah, so it's really important for them to come for the education session. There was a patient of ours that came for the session, and because it is time-based and because obviously you have to turn the machine on and off based on the time. So if you leave it on and you've gone over time, then obviously that's a risk for a burn. There was one patient that actually I gave the session to explain to her that she's got to be very careful with monitoring and making sure that she turns it on and off within the time frame. So they have usually we recommend that they use their phone rather than the stopwatch that's provided, because it's battery operated, and if the battery dies then they're stuck. So yeah, we recommend they use their timer on their phone. But yeah, this one patient, she decided to watch a movie while she did her home-based phototherapy treatment, and she received quite a bad burn from that. So it's just really important to reiterate and for them to come for their sessions, because we do have a bit of...
And adherence to the timing, and also concentrating on what you're doing so that you're not going to get distracted, so that you aren't going to cause yourself a burn. I mean, bless that she thought she would do this while she was watching a movie, but she wasn't paying attention to the timer and all the time, so therefore... And we have developed a burns protocol, which is in our booklet, and I can send you out that as well, that tells them what to do if they sustain a burn and what they need to do. So we want them to stay that carnation pink. If they start to get if they do start to get a burn, basically we want them to stop the treatment, send photos into us, call us. We will review the patient to decide what course of action, whether they need to stop treatment, whether they need to have some corticosteroids, and what they need to do. The burns protocol is it's very cohesive in what we do, isn't it? It's very, very good program. It took us a while to develop that with Dr. Gupta, but we've done that. It's also the one we used for our cabinet therapy, but it is really important that the patients understand this burn protocol. So they're given all of that. They're given the strict instructions on what to do and how to do it. If you have any issues, any questions, send us photos, give us a call. So they're not left on their own. They do have that support base there, and that's why it's nurse-led, because we want to be with them every step of the way when they're doing this treatment. If they have any issues, any problems, give us a call. That's what we're here for. And if they want us to go over things again, to say, I've forgotten this or I've forgotten that, it's not a problem for us to go through and reiterate again what we've done and how we've done it, and you come in and see us. It's not a problem. We have had a couple of referrals from outside dermatologists. Dr. Gupta is our primary referring dermatologist, but we accept referrals from anyone who wants to send us referrals. We accept any outside dermatology referrals. That's not an issue, not a problem. They can come to us. We can teach them home-based phototherapy. They can follow up with a dermatologist outside. We are very proud of what we've started. It took us a long time to get where we are, and feel free to come up later and have a look. We've actually developed what we call a nurse's guide. So when we're teaching other people how to do it, you read through all of this so that you're up to date with everything that goes on. We've also got one for the patients to sit through, and they can have a look at that goes through, you're starting home-based phototherapy, this is what it is, this is what we're going to do, basically. So if you want a copy of all of these, we can email you the link to that. That's not going to be a problem. But that's what we use for our patients, and they find it it's very easy to understand. They like the fact that it is a nurse-led clinic, that they can talk to us, which is really important, I think. And research and literature has shown from the research that we have been doing in England and also in the States that this is a safe, effective treatment to use for home-based phototherapy. And it's only new for us because it's an Australian experience for us. It's the first time we've ever done a trial for home-based phototherapy. Normally when you think of home-based phototherapy in England, they think if you can hire a hand and foot machine, you can hire a booth-based machine. This isn't. This is handheld. You buy this and you do the treatment yourself at home. So this is a first for us, and we're very proud of the research and the success we've had with home-based phototherapy. That's the reason we thought that we would share it today, because for vitiligo, there's not, other than phototherapy, other than the non-cultured melanocyte transfer experiences, there's not a lot of things that they can actually take control of. And this is something that they can take control of. We're giving them back that control to be able to take some control in their skin condition and an improvement in their skin condition. And their overall gratitude and just their overall demeanour when they come back in is just amazing. They are so proud of what they have achieved, and they said, oh, thank you, and we go, no. We say thank you and kudos to you because you're the one that's put the hard yards in doing all of this home-based phototherapy. I've just taught you how to do it. You're the one that's been consistently doing this home-based phototherapy to get the outcomes. I've only guided you, and you're the one that's been doing that. So we've empowered them. We've empowered them basically to actually take control of their own care, which is something I think is very, very important in the care of dermatology and dermatological patients, is you're empowering them to take control of their care, knowing that they can actually do something, that it's not beyond their scope. That's the thing that we find really important about this home-based phototherapy in the study we've done, is that it's empowering patients to take control.
And it's something that, once they purchase it, they have it for life, pretty much. And, as Glenda was saying, they can, purchase the globes and everything like that. So it's, it's really great.
And if they do find that, a life stressor occurs, which we know life does occur, whether they have an illness, whether we're finding some patients, which will be another whole research project, I think, is their vitiligo has become unstable because they've had the COVID vaccines. So there'll be going to be research on that as well. Whether, for whatever reason, if they started to depigment, they know what to do. They can come back and see us. We can empower them and go, let's start your doses again. Let's take some more photos. Let's begin from the beginning. So they know that they've got a support network there, that if their vitiligo does become unstable and if they need to go on medications, that's fine. They can do that, but we can also offer them the home-based phototherapy if their spots are still smaller. Now, it's only up to 4 spots. It's a targeted therapy. So no more than about 4 spots on the body is good. Otherwise, you're going to be what we call chasing spots. So they really need to go into booth-based or home or hand and foot cabinet if you find that you're chasing too many spots.
And also too with the handheld device as well, if they've got really small spots, the handheld device is quite sizable, maybe this long. So if they want to expose any of their pigmented skin, so they'll go darker in those areas, we suggest that they use like a sock or something to place over the device, and they can cut a hole out, just the size of the vitiligo on their skin, and just obviously a border around just to get some of the pigmented skin as well. But yeah, it's really good that they can do that as well, because they do get worried about having the hyperpigmentation on the the pigmented skin. So,
and a few of our patients have had that. They will get a bit of hyperpigmentation while doing this treatment to other areas of the skin. That does settle down, but we tell them the main area we want to concentrate on is probably about a half to a centimetre around the area of where you've got your vitiligo, so that the melanocytes will start to migrate from the outside in. Sometimes you'll get patches of vitiligo coming back from the inside out. You'll get islands of melanocytes popping up, but basically we want it to migrate in from the outside. The spots get a lot smaller and you get the repigmentation drawing in, so the spots are a lot less. That's our aim with doing home-based phototherapy. And as Jen said, with the sock, they're able to cut that area out. They're not exposing any extra skin that doesn't need to be exposed to the light. It's just treating that area. Okay.
Does anyone have any questions?
Feel free, we're here. Depending on how big the widespread disease is with these patients, there's a DermFix 2000 machine as well, which actually covers the larger areas. It's actually got 4 globes in it, and it covers larger areas. So if you've got sort of larger, you would probably want no more than 4 to 6 areas to treat, because otherwise, if you're at home, if you want these areas to repigment. Oh, sorry.
We don't know what you're asking.
Sorry. What Adette was saying, that she's got patients who obviously are rural patients that have got areas of vitiligo or treatment, need UVB treatment. Is this something that what you're asking, Adette? Can they use this home-based phototherapy? And if there are larger areas to be treated, could you use a home-based phototherapy machine? Yes, you can. There's a DermFix 2000 machine available at the moment. And yes, you can use that. It's got the 4 globes in it, and it will treat larger areas, especially for people who are isolated. This is a really good option for people who can't get into home-based, booth-based phototherapy, can't get into hand and foot therapy. This is a much better option. And again, you can purchase it from Dermfix, and you can get them on Amazon as well. So yeah, it is a good option. They can actually use the home-based phototherapy for that. It will help with their repigmentation. It will help with their skin diseases, definitely.
Yeah, we could probably just focus on maybe the areas, the really, severe areas, I guess, of the skin, the more widespread ones, because it is could be quite time consuming once the dose reaches and the time goes up. So yeah, like you could maybe just recommend that they focus on the really bad areas, I guess.
The target areas that they mostly want treated, if it's around their face, around their body, whatever target areas that they want treated, you can definitely use home-based therapy for that, definitely. But if you find you're going to chase too many spots, they are better to try to make it to come into booth-based or office or hospital-based phototherapy. And I realise that rural areas don't have it, and this is a great option for home-based phototherapy to be, delivered to the rural areas. I think it's great for people who are in the rural areas who have got, and that's something that we haven't done yet, but that's something that will be on the plan to do, will be to go into rural areas with home-based phototherapy, talk more to the derms out there. Do they have patients that have got vitiligo? Do they have patients that want treatment? Or, people with psoriasis using it for the comb, especially for the scalp. But yeah, we mostly did this for vitiligo, but yes, you can use it for eczema and you can use it for psoriasis as well.
I think it was actually designed for psoriasis, wasn't it? Scalp psoriasis with the comb. Yeah.
Usually. Yes. Can we use sunblock? We recommend that you don't, because patients are very unreliable in placing sunblock on, and they may place sunblock over the areas that need to be treated. Because sometimes they've really got to be very, very particular about where they put the sunblock. And yeah, we just find it's unreliable. We've had a couple of our patients do that and their results weren't as good as they could be. And we asked them why, and they said, I'm putting sunblock around the areas of where I'm treating. So we just say the sock is better because it gives you better coverage and protection rather than sunblock. But we tell them also when they're having this treatment to be very mindful and to be sun smart when they're outside. Once they've had their treatment, they do need to put sunscreen on. They need to be sun smart. They need to wear a hat. They need to put sunscreen on. They need to protect their areas so that they don't get double exposure, so they don't get extra light to that area. That can cause increased erythema and can cause a burn. But yeah, we found that we just tell them not to put sunscreen on because patients can be quite unreliable in putting sunscreen on. They get a little bit too liberal and they forget where they've actually put it, and then they're wondering why their treatment doesn't work as well. But at the same token, you can try. You can try with your patients, because what we recommend this for is patients that we know that are going to be consistent, we know are going to do this therapy, are going to be vigilant in doing this therapy. So you can try with them if they know that they're going to be vigilant and you know where they've put the areas of sunscreen. You can try it, but we just haven't had great success with doing that. But it doesn't mean that, if you've got patients who are very vigilant and know what they're doing, you can try. No reason why you can't try. Yes, Gemma.
What's the youngest age that you would typically do this on?
Now, Gemma asked what our youngest age was. The youngest patient we've done home-based phototherapy on is 3. And what we did with that was Mum put some music on or some cartoons on for her to watch, and we just called it a magic wand that's going to make your skin better. We made a game out of it. We made it fun so that Mum could get these areas treated, and she actually repigmented quite quickly on that. She had it on it. That was for vitiligo. She was 3. We've not actually used it for eczema. We only did our trial for vitiligo, but yes, you could. You could, if you can make it fun and you can make it interesting for the parents to be able to do this therapy, there's no reason why you can't. Not at the, I know in England they are, and I know in the States they are, but not necessarily in Australia. This is our first, and we chose vitiligo. But the literature is saying, yes, you can use it for eczema and you can use it for psoriasis. Yes. I think it would work quite well. Yeah, I think it would actually work very, very well, Gemma, actually, I think, on those patients. And yes, you could use it. The dosages in the booklet aren't just for vitiligo. They can be used for home-based phototherapy. They can be used for eczema on the hands and the feet. There's no reason why it couldn't. That's the thing. It's not just vitiligo. We did our study on vitiligo, but it's got so many other uses. It's got so many potentials for this to take off. I can see there being more studies in it being used for eczema, psoriasis. I can see a lot of studies coming out of this information. But we just literally chose ours for vitiligo. But the literature is out there and it's wide. Yes, you could use it for eczema and you could use it for psoriasis, especially for the kids. Mm. And then, coming to have, there's no reason why you couldn't use this, none at all. It'd be interesting to read the studies if anyone was going to do it in Australia to see how it went with eczema. I'd be very much interested to read that literature. I think it would work, definitely. With what we've discovered with vitiligo, yes, it would work with eczema. And we've done, as I said, one little girl, she was 3. She repigmented quite quickly, but then her disease progression, it started again. So she's now back in booth-based with us and she's now 6. So it works. We just made it fun for her. We made it fun to say this is going to help your skin. We just made it like a magic wand, because when they start to see improvement, it is a magic wand. It's wow, it works. Mummy, can I have my magic wand today? Is what she said to her mum. Mummy, magic wand. So she knew when she was going to have her treatment times how well it worked. Yes. They can do a maintenance. They can do it once a week if they choose to do it. They can stay on maintenance if they want to. But most of our patients find once they've repigmented, they're quite happy with the results. They don't often go back to using the machine unless they've had issues with depigmentation again. So they don't have to be on maintenance. Once their skin is repigmented, they don't necessarily have to be on maintenance if they don't want to. They can if they want to. Not necessarily. Once the repigmentation is there, literature is saying that it's usually permanent. You might get areas of very, very mild depigmentation. Then they might want to go back to doing the treatment again. But if you wanted to keep them on a maintenance dose, yes, you could. They could be on a maintenance dose once a week. Just once a week, maintenance dose will be fine. One of our patients, I think, has actually decided he wanted to be on a maintenance dose, and we've said that's fine. And he's quite happy with that. He sends us photos and updates. So no, you could use a maintenance dose, yes. Yeah, there's no reason why you couldn't at all. Yes. Hello. Question is, any difference between eczema and home-based phototherapy? Eczema is also used for target-based home-based phototherapy. It's 308 nanometres and it is laser top therapy. The literature is saying that you get good results for both. You get repigmentation with both. The only thing with coming in 3 times a week being charged $50, and the cost of the machine, obviously, and the maintenance of the machine, patients are finding that it's, some patients are quite prepared to pay the $50 to come in 3 times a week because they know that it works. And they know that it's also nurse-led, but they know they can come in to the clinic and see us and we're doing the treatment. But with home-based, some patients are quite prepared to do it at home. Others want to come in and actually have the eczema treatment. So it can be used both, eczema and home-based phototherapy. I think it was the cost factor, and also patients coming in for time constraints couldn't come in, and being consistent. You've got to come at least 3 times a week for these treatments to work when you're having eczema therapy.
Yeah, I think as Glenda was saying, the consistency is key. With the eczema, the 3 times a week, and it also gives them, gets them into a routine so that when they do eventually go into home-based phototherapy, they already know it's 3 times a week and how long it's roughly going to take. So yeah, at least that way they're building up the momentum to start the home-based. But yeah, also our staff specialist for the vitiligo, Dr. Gupta, she does prefer patients as well to start with the eczema first, just to make sure that they are getting some kind of result, because there's not really much point in the patient committing to buying the machine, having an education session, and then finding that doesn't even work for them, and they're not repigmenting. So yeah, it's good for them to at least do about 20 sessions of eczema first before they progress on to the home-based phototherapy. Yeah, that's what was recommended, I guess.
Yes. basically we tell them that they actually have to close their eyes. We can get them to wear smaller goggles if they want to, but we basically tell them to close their eyes. And it's good that if they've got someone else around with their eye treatment, if someone else can help them do the treatment, because it's very hard when you've got to close one eye to see what you're doing. And because vitiligo is like wet paint, it's very hard because the goggles are going to rub and cause trauma to that area. We recommend patients just close their eyes tightly and do the treatment. It's about the only option we've got that's not going to sort of cause any trauma to the area and cause any excess vitiligo to appear. We just tell them to close their eyes, and they're quite happy to do that. And they can hold the machine further away from their eyes. They're still going to get the light there. It doesn't have to be held close. As long as you're getting light to that targeted area, you're still going to get results. And that's the important thing. They can hold it further back if they're worried about the light being bright, because any light they get into that area is going to cause some repigmentation to happen. It's just going to be a little bit further back, and it's safer for them. Yes, Darren. Yes.
With the study that when you had patients that started in the study and then they decided they wouldn't want to come back to the nurse, what was the number of those?
We had, let me check my other statistics that I've got here. We probably had, let me check. I think I said about 20 people. Yeah, about 20 people of those that purchased the machine. About 20 people didn't purchase the machine and didn't book an education session, but were spoken to about actually, doing home-based phototherapy. They got the information from us. We had probably about 40 people did start, and they had less than 20 sessions with us and never followed up, never came back, never let us see all the results.
Because one of the outcomes with my PhD was on patient education, learning is turning that information into knowledge that they can use and into the context, etc. And one of the things that the parents and the nurses came up with is the fact that they don't really understand why they have to come back to the nurse. You tell them.
Yes. Come back.
Yeah. One of the things that the parents and the nurses said was that an analogy is really helpful. Now, all of you are probably using analogies in your clinical practice all the time to explain things to patients for whatever condition it is. But one of a really good analogy was that if it's like learning to drive.
True.
I put this in the GP talk that I did yesterday for the GPs, and they were going, didn't think of that. When you learn to drive, and nearly every patient will have gone through driving lessons.
Oh, definitely.
You give them the keys, you give them the car, and you got the menu. They're all, probably electronic now, but the office like us, we have a menu. But you need to go through a series of driving lessons and practice and all this sort of stuff. You'll be able to work out how to drive that car safely, and then eventually throw your own place in the sessions. So one of the analogies with the parents and nurses that might be useful in your situation is that now you're going to think, well, I have 2 sessions and I'm not going to need you anymore because you're all fine. But you could use that analogy in that you know like a machine, and if you think back to when you drove your car, that you needed X lessons or whatever so that you could fine tune it, have some practice, you couldn't.
Exactly.
We
know what you mean, yeah.
And so they can liken it to something that was really meaningful to them. Oh my goodness, if I don't go back and see Glenda, I might be, if I liken it to my driving lesson, I might get to the end and be able to drive.
Exactly. And am I doing the right thing? Am I following what,
It's a thought really that might be useful. I mean, for any area of clinical practice, we struggle to get people back. So
we do.
it's fine for
Yeah.
We do.
as soon as it's fine, then we just throw anything in, don't need anymore.
I love that analogy, Darren. Thank you.
We say, well, really, you've only had 2 driving lessons. Did you get to drive a car yet? And
Exactly.
they say, oh, no, maybe not. So you say, right, well, we're going to guide you a bit more. You're doing a fabulous job. You get the praise, you have the confidence. And then say, right, well, we just need you a bit more. And then gradually you're going to
exactly. Yeah, perfect sense. I like that analogy, actually. Thank you.
Might help, particularly if you have trying to capture your data
Mm.
in your job these days, any dropouts,
Mm.
the hierarchy that count the deans often say, oh, well, look at all those that dropped out, you can't do a very good job. You can say, oh, no, sorry about that. And it might mean that you've only got 2 dropouts instead.
Yes, so if we reevaluate what we do and how we teach,
Yeah.
It was you know, a bit of a wake-up call to me to think, well, you know, we explain all this stuff, but the language they hear is not the same words that we're actually, and I'm not talking about cultural language difference.
no.
It's just the meaning for them is different to what we think we are saying in plain English, because they don't understand why we need to facilitate that journey.
Yeah, they don't understand, why do I need to come back? It's like, well, we want to see your progress.
Rehab is quite different, you know, they'll come back to all the appointments because they can see the meaning. But a lot of the things where we've got to explain, and it's the unknown, because they don't know what the unknown is.
No.
What do we say? You don't know.
That's right.
Yeah,
Yeah, so the driving is quite a good analogy.
I like that. Thank you. I remember that.
Really good.
Any questions on this side? Yes.
And firstly, well, thank you for sharing that one. It was a really wonderful learning opportunity for us sitting here.
You're welcome.
This internet talk and how you empower patients. I just have a question regarding this study. So with those participants that were included in there, was home-based phototherapy their primary treatment or a complementary treatment to their vitiligo?
Most of them, it was their primary treatment. They did have, some of them had used Eczema, but we only picked the ones that had just started with home-based phototherapy. So they're the target we wanted, was the 61 people, was that had just started on home-based phototherapy, had only been referred for home-based phototherapy. That was our target specific.
So within that cohort, there were patients that were actually on other treatments like steroids?
Some of them were on steroids, yes. We find that tacrolimus works very, very well with eczema therapy. It's a very good conjunctive therapy for patients with vitiligo. So most of them were on a non-calcineurin inhibitor. Yes, they were on that. Plus, they were also having home-based phototherapy. So we only looked at home-based phototherapy, not combining with topical steroids, which there is some literature about topical steroid use and vitiligo, plus also calcineurin inhibitors and vitiligo. But we just concentrated on those that were using tacrolimus because that's what Dr. Gupta prescribes. She prescribes the tacrolimus, plus she also prescribes the home-based phototherapy. It goes together.
So was that counted in the results?
No, it was just home-based phototherapy. It was the home-based phototherapy study, and that was included. That they were all our patients were on the tacrolimus. It's not, we didn't separate it. We just thought that's the therapy itself, was the home-based plus being on the tacrolimus, the non-calcineurin inhibitor. But we could separate that. It would be interesting to know. Yeah, something else. There's a lot more that we can do there's a lot more research going to be done on the home-based phototherapy. It's a wide scope for research. We've just opened the door, basically. We've opened that Pandora's box to see what's going to come out now. And this was just a start with us when we decided to do this. We thought, well, let's go with this and see where it leads. It's where it takes us. It's an Australian experience. It's never been done before. So we purchased the devices, read the literature, did our research, and went, well, this is something that we think is valuable, is going to empower our patients. But also, as Darren said, you've got to make sure they understand the knowledge that you give them and why it's important for the follow-up, why it's important to always touch base, to always follow up. And then, you'll need us for the first, month, then you might gradually taper off from needing us. But to know that support is always there as well. But yeah, I think we're going to have there's a great future. As one of the fathers of dermatology said, the future of phototherapy is bright. That was his quote, the future of phototherapy is bright. And I tend to agree with him. I think the future of phototherapy is very bright. There is a lot more research to be done, a lot more that will be done, and I'm excited to be part of that research and to keep doing what we do and educating people and patients on how home-based phototherapy works. Push my false teeth in. Phototherapy, how it works. And one of the things I just wanted the cartoon was, I don't know what these dots are, but you mind if I connect them? I just thought it was quite funny for someone with vitiligo. He said, I don't know what they are, but can I connect them? Can I get them all together? Now, my email is also there. You can also contact us at Skin Hospital, both our Darlinghurst branch and our Westmead branch. So they're our contact. Oh, he's taken it off. Oh.
Is it in the booklet?
Oh, we are nearly 10:23, so I'm probably being told that's it. Cut it out, cut it out. Well, I think they've cut me off because it's 10:23, so if nobody has any more questions of the...
Oh, yeah.
Yes, you can ask one. What it does is they have a start dose and then they increment, same as you would in normal booth-based therapy, they increase every time till they maintain their pinkness. So it's 7% if your skin type's A and E, A to B. C to D, it goes up 14 seconds every time. And if it is skin type E and F, it goes up 23 seconds every time. So yeah, it's increased every time till they maintain that pinkness. And once they've got that pinkness, we want to hold the dose. We don't want them to get burnt. We want to hold that dose and then to see if they continue to repigment from there. So if you want any information or just email me and I can send it out to you about what we're doing about home-based. Not a problem. We're more than happy to share the information that we've done because, as I said, this is an emerging field and we've only just started. So there's a lot to gain for the patients and for us nurses as well, learning about home-based phototherapy. So I hope that I've educated you enough and I've hoped to be able to answer your questions as much as I could today. And I hope you enjoyed the presentation. So thank you. And thank you for Jen for helping me.
Like I said, can't take credit. She did all the presentation on her own.